the nose. So that cavity is called
Nasal.
no. One cavity is nasal cavity, but what is that part called? No, this nostrils. Then this cavity is the nasal cavity, right? This whole thing actually. Then in the nasal cavity, on the lateral wall, there are these ridges. These are called the concha. And then from the nasal cavity, air then goes into this area. What is this area? You have to check your notes from today. Nasopharynx. So if I put a sticker here, nasal cavity. But if I put a sticker here, in this area, is nasopharynx. So all this. In the nasopharynx, on the posterior wall, this is referred to as
The adenoid.
adenoid. This whole thing is the nasopharynx. This is the adenoid. Then right here there's an opening, and that is called the eustachian tube. The nasal cavity is separated from the oral cavity, this is the lips, oral cavity, by this
The palate.
palate. Right here it is the hard palate, this is the soft palate. This is the oral cavity. So this area, now I'm talking about this area, just behind it, that is called the
Oropharynx.
oropharynx. At the base of the tongue, they didn't show it, there's an lymphoid tissue called lingual, but I can't ask you. But right here they've shown it. This pinkish colored thing is the
Palatine.
palatine tonsil. And below this oropharynx, right in this area, the small, what have they written here? O? What is that alphabet?
O or zero.
O or zero. That is what is they're asking about laryngopharynx. From there, this is the common passageway for food and air. This is the
Larynx.
this is the esophagus, whereas this is the
Larynx.
larynx. Why doesn't food go into the larynx? Because of 7. Oh, what is it? This blue thing. Epiglottis. With me? So, this is the larynx. This whole thing is the larynx. What bone do you think this is? Hyoid. So this larynx has this part which is preventing food from going into it. And that is the
Epiglottis.
epiglottis. Then it has this big cartilage, one of them. It is the Adam's apple, thyroid.
Thyroid.
And then below it, this gray thing, below it,
Cricoid.
that's the cricoid, but see how it becomes big at the back. This all is cricoid. The thyroid is mainly in the front. Whereas cricoid, there is in the front, but majority is at the back. This gray thing. So that whole thing is the cricoid. Those are the unpaired. Now coming to paired. Can you see these two big things? What I'm holding? This and this. These two things. These two big things. Those are your arytenoid. And there are 2 of them. Now if you look here, the tip of this arytenoid, that is called the cornicate. Whereas this pointed part right here is your cuneiform. I can't move it there. Can you see it? This is your cuneiform. This is your cornicate. But this whole big thing is the arytenoid. So if I put a sticker here, what is it? Cornicate. If I put at the pointed part, cuneiform. So cornicate from here to here, cuneiform right here, and this whole thing is arytenoid. With me? So those are your cartilages, 3 unpaired and 3 paired. On this model is the same thing. This is your larynx. Remember I said don't confuse with thyroid gland. This is your thyroid cartilage, but this is your thyroid gland. So we're not talking about it today. So this is your hyoid bone, the same big one. This is your thyroid, this is the cricoid. Now, if you split it, it has vocal cords, the larynx. This red thing is the up one. Which one is it? False or true? False. So the white one are the true. And then from here down is your trachea. Now trachea has C-shaped cartilage. So follow the gray. See, there's nothing at the back because what's coming at the back? Esophagus. This is a better model, but it's not here today. Anyway. Now this is the lung. In the lung, the top part is apex, the bottom is base. All this is with surface.
Costal.
No, but with surface, costal. Whereas this one facing the heart is with surface,
Mediastinal.
mediastinal. So apex, base or diaphragmatic. What I'm holding is costal. This side is mediastinal. On the mediastinal, can you see there's a hilus? And in the hilus, so this is from the heart side. This light blue is the primary bronchi. This is the pulmonary artery or vein? Is blue, dark blue. Which one? Artery. And there are 2 pulmonary veins, and they didn't show it, but sometimes some models have it in green or yellow dots, which are lymphatics. This is the whole lung. Can you see this oblique fissure? And can you see the horizontal fissure? What lobe is this?
Upper.
Upper,
Lower.
lower, and that is the,
Middle.
since it has 3 lobes, which lung is this? The right. That's it. There's one good model missing, but if not, we'll ask questions on the diagram.